Hi, I'm Lynn. I live in Telford and I am a member of Telford Patient First.
Hi, I'm Dr. Chan. I'm a GP in Telford.
That's lovely, lovely to meet you. I'm here today to ask some questions from the Telford Patient First group, some questions around the Healthy Hearts campaign. Are you able to give me some information on this?
So while we're making a lot of improvement in the care of and the treatment of coronary vascular disease locally, we know from our experience and evidence elsewhere that we could do more to improve the outcomes of this. By coronary vascular disease or CVD, I mean problems with circulation of the blood around the body. And this causes illness such as angina, strokes or heart attacks.
So, Dr. Chan, can I ask, are all GP surgeries in our area getting involved in this campaign?
Yes, all surgeries in Telford and Brecon have a nominated person or member of staff to take part of the clinical group, and where we discuss and agree on how we're going to help people to better manage the risk factors.
So, can I ask, is the project all about getting people onto statins?
In actual fact, no. There are 4 areas of work we're looking at. So, the cholesterol levels, high blood pressure, atrial fibrillation, and heart failures.
Are you able to tell me, Dr. Chan, how are GPs deciding who actually gets a letter?
That's a very good question, Lynn. The GP will know about this through the patient records of who would benefit the most out of this initiative. And there are a number of patient groups that we aim to target specifically with Healthy Hearts. So namely patients who has previously been on a statin but have stopped, or patients currently on a similar statin but would benefit from a higher dose of atorvastatin, which we know from research that this would have a better outcome in terms of managing the long-term cardiovascular risk in the long term. And also in patients who is currently suffering from heart disease, or patients that we know would suffer from heart disease in the long term that has not been on a statin.
So, Dr. Chan, can I ask you, what if I think I fall into one of those groups but I haven't had a letter?
So there are a number of situations whereby statin would not be suitable or advisable to a patient, particularly if they have a history of liver disease, if they're pregnant, or if they're on a number of medications that would have an interaction with atorvastatin. But for the majority of people, statin is quite safe. So if you think you fall into one of the categories, and you should really be talking to your pharmacist, the practice nurse of your GP. Also, if you have other conditions such as dementia, your GP will review whether statin is suitable for you when you next attend the surgery, rather than sending a letter out.
Can I ask you, how does the doctor know if a patient is at significant increased risk?
Well, what we have in general practice, our computer system will provide us with that information once they're recorded in the patient's medical record. And there is a tool that we use called QRisk, and it is a formula that we use to consider all the different factors of the patient's health in order to come up with the risk assessment. So this tool puts in consideration of the patient's age, the gender, the smoking history, blood pressure, cholesterol, some medical conditions such as migraines, erectile dysfunction, severe mental illness, and chronic kidney disease.
There's a great deal of information for a patient to absorb. Can you tell me, where do patients actually get further information from?
Okay, so on the clinical commissioning website, there is a web page called Telford Healthy Hearts, or you can talk to one of the Telford Healthy Lifestyle Advisors, which attends each of the practices in Telford, or visit the Live Well Telford webpage.
I'd like to thank you, Dr. Chan, for explaining the Telford Healthy Hearts and the information you gave us about statins.
You're most welcome, Lynn. And if you have any further questions, or if any of the patient group has any further questions, please do send an email to the Clinical Commissioning Group in Telford.